Good morning, everyone. Welcome to the Joint State Federal Relations and International Insurance Issues Committee. Thank you for joining us this morning. My name is Paul Etke. I'm your chair for this committee. And the first thing on the agenda that we need to do is I would like a motion to waive the quorum.
So moved.
Is there a second? We have a second. All those in favor signify by saying aye.
Aye.
Opposed? Motion passes. Thank you. And next up, we have our meeting minutes from November 20th, 2021. I would entertain a motion on the minutes. We have a motion to approve. Is there a second? Second. And we have a second. All those in favor signify by saying aye. 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 Opposed? Motion passes. Thank you. First item on our agenda today is an update and discussion on implementation of new federal balanced billing law, the No Surprises Act. And with us we have Lauren Alder, Associate Director with the USC Brookings Schaefer Initiative for Health Policy. Lauren, welcome. And you can go ahead with your testimony or your presentation.
Great. Thanks for having me. Excuse me. I'm Lauren Adler, with the Associate Director of the USC Brookings Schaefer Initiative for Health Policy, health economist based in Washington, D.C., and have done a lot of research on the surprise billing issue and a host of others. And obviously with the passage of the No Surprises Act last year, there's a lot of interest in sort of with a number of states who already had laws and sort of aligning and figuring out the regulatory and enforcement schemes of the law. To start with, just sort of a quick level setting on the issue, since so surprise billing had been a problem for decades, really, and it is primarily we're talking about either emergency care. These are cases where the patient does not have a choice over their provider. So, you know, we're talking about emergency situations where you show up at the ER, the ambulance takes you to the ER, or in situations where you make the conscious choice, you choose an in-network hospital, you choose an in-network surgeon, but it turns out the anesthesiologist or the radiologist that you had no choice over was not in your insurer's network. And if that happens, you, the patient, are stuck in a predicament where the insurer will pay something, but the doctor can then balance bill you for the difference between their charge, sort of just a list price, you know, think the MSRP on a car, and whatever the insurer paid. That obviously it can cause financial hardship, right? These are often $1,000 bills or so. And right, this is sort of the figure on the screen right here, just showing that this is quite common, right? I think there was a lot of news coverage bringing up anecdotes here, but it really is more than a series of anecdotes. It's something like 1 in 5 times that a patient ends up at an ER, they would have been at risk of one of these surprise bills. And right, this is, it's not at every hospital, right? Most hospitals actually make sure that the anesthesiologists or the ER docs who work at their facility also contract with the same insurance companies. So at most hospitals, you know, you're not going to get balance billed, but at, you know, a small, not too small minority of hospitals, basically everyone who walks through the door is at risk of getting balance billed, or was. Should use all past tense now. So this is just sort of right. There's a lot of private equity activity in the emergency medicine and anesthesia specialties, and it was quite clear that this was a business strategy. I think they were quite clear in their communications to Congress as well that this was being used to leverage negotiations with insurers to try to get paid more money eventually. And you know, the idea wasn't to balance bill patients, but to try to make more money. And this really represents a market failure. The problem here is that it is very hard for the insurance company to steer patients to in-network providers when the patient doesn't get to choose who their doctor is. So, you know, this isn't a problem for your primary care doctor or your cardiologist or name a specialty that the patient is choosing. This is only a problem in the sort of edge cases here where it is the doctors that patients don't choose. This is, even if you tried to choose, when my wife gave birth, I actually tried to call the hospital and find out if the anesthesia group accepted my insurance. I got the runaround like 10 times and never even got an answer, and just sort of winged it. So that's sort of where this comes from. And I think we knew that this leverage basically allowed these specialties, and particularly kind of a subset of those specialties to garner higher payments. And those prices are reflected back in the premiums that we all pay. Right, so I think premiums for insurance, or commercial insurance here we're talking about, were more than 1% higher than they otherwise would have been. And that is where the No Surprises Act comes in, right? A number of states over the last decade in particular have started passing legislation on this issue, but the states are restricted in sort of how broad their protections can be. So the No Surprises Act is now we have federal legislation that took effect at the beginning of this year, and this applies to almost all kinds of surprise bills, surprise out-of-network bills. Right? It's not every surprise bill. A lot of people just didn't know their deductible was high. It's not that sort of bill, but when we're talking about these surprise out-of-network bills, and it is literally any emergency out-of-network bill. It is sort of post-stabilization care. So once you are stabilized at the hospital, at an out-of-network hospital, you have to be able to be safely moved to an in-network hospital before your protection expires. And this also applies to air ambulance transports, and then to the sort of case of anesthesia and radiology that I was talking about before, where you're at an in-network hospital, but some of the doctors that practice there are not in-network. The notable exception not on this is ground ambulances, so that is sort of an issue that sort of still stays out there. A few states have laws regulating ground ambulances, and a lot of states and localities have some sort of price regulation on their ground ambulance companies, but I'll sort of leave that aside for now. Right, so the core of the No Surprises Act is, right, so there's the consumer protection angle here where, right, it is patients cannot be balance billed anymore, and the insurer has to treat this care as if it is in network for purposes of patient cost sharing. And then on top of that, it sets up this process to basically determine how much the insurer owes to the out-of-network doctor or the out-of-network hospital here. That is where all the contention of the issue has come. But right, so they set up this IDR, an independent dispute resolution process, sort of an arbitration. It gets likened a lot to the baseball arbitration system, where each party, the provider and the insurer, make a final offer, and this neutral arbitrator has to choose one or the other, and that becomes the final payment. And so the law itself instructs them to consider whatever the median in-network price would have been for that service, so trying to think of what was sort of the market price for this issue, and then it lists sort of a host of generally a little bit more vague what they call additional circumstances and additional information, like the severity of the case, how good the doctor is, and that sort of thing. That is sort of where this big dispute has gone. Right now there are a number of lawsuits very focused on this arbitration process. So almost all of the lawsuits are pretty narrowly focused on, so the administration came in and basically wrote guidance that said, sort of took the factors enumerated in the law and said the arbitrator is supposed to choose whoever is closer to this median in network price, unless there is credible evidence that they should deviate. That garnered a lot of contention. There were lawsuits. A number of provider groups sued, and most recently, last week, the Texas Medical Association won their lawsuit in the district court level. In Texas, there are, I think, 5 other suits that are effectively the same exact case elsewhere in the country right now. But the upshot of that is that temporarily that guidance is stricken. So the arbitrators still look to the law itself, right? It doesn't. The law itself still enumerates factors here. So just sort of thinking about what's next here, I think there's a lot of confusion on exactly what this means. So, right, there's a temporary stay against this one piece of the law, but the rest of the law, the consumer protections are still holding, the enforcement and everything like that is still holding. There's similar cases being held on St. Patrick's Day in D.C. that are going to be heard, including one from the air ambulance group. These cases can be appealed, and actually the administration has said that they are planning to issue a final rule. Very technical, but basically it'll actually reset the process. So the administration is releasing this new rule by May of this year. The first rule was what's called an interim final rule, and this is now the actual final rule. So that basically resets everything, and we'll have to go through the courts again unless they change it in a way that provider groups are satisfied with. And if not, you'll go to appeal courts after the district court. You end up at the circuit, and could end up at the Supreme Court. There is one pending case in New York that is challenging the entire law. There has not been much movement on that yet so far, but that is the one case that is challenging this on a constitutional basis, the actual whole protection. And then just sort of get to the interaction with state laws here. Right, so a lot of states have laws that regulate surprise billing. Most of them are, so the problem is they generally only apply to folks in what are called fully insured health plans and do not apply to the folks who are in self-insured or generally large employer plans where it is technically the employer who is sort of footing the bill at the end of the day. So the federal law will often supersede state laws. So in that case where for the self-insured employers, the federal law holds, and then in any case where the sort of existing state law does not apply, the federal law sort of wraps around that for the fully insured population. And right, so that is, and sometimes this is happening. States can also have more protective laws. So to the extent that the state law is more protective than the federal law, that will hold. And then sort of the payment policy between the insurer and provider would be governed by those state laws for the folks in fully insured plans. Right, I think this sort of raises one big question that sort of I've talked to a number of folks at the state level who are considering this is just sort of, it's a little bit cumbersome to run two parallel surprise billing processes at the state level. There is sort of a question of how do you align them, especially if you're running two different arbitration processes and things like that. I think a number of states have sort of said, like, actually, let's just sort of sunset our own law and just have everyone under the federal law. Is an option that is out there. I think there's a number of considerations to talk through there. But and then just sort of stepping into enforcement, because I know that's probably of interest to some folks here. So, right, the states have primary enforcement over a fair bit of this law. So, right, so over basically any of the provider billing practices, the states are the first line of enforcement. And then for all of the fully insured health plans, right? That's something that states are more used to. Departments of insurance are used to regulating those plans. And then there is an option for what's called a collaborative enforcement agreement, where the state is sort of making sure that providers and folks are complying with the law, but the federal government would be the one actually administering penalties if the couldn't get to voluntary compliance. And then just the role of the federal government also, they maintain their authority over the employers, over the sort of self-insured plans. And then they also have sort of the fallback enforcement. So if a state refuses or doesn't want to sort of take up the enforcement angle here, the federal government will step in. It's not like the law doesn't apply if the state chooses not to enforce. And I'll stop there. I think there was Q&A, but I will.
Okay. Thank you very much. We have questions or comments?
Got one.
Senator Hackett.
And you just touched on it, sir. You just touched on it on the ground ambulances. So the feds excluded the ground ambulances, but at the same time they put in there that study task force. So, of course, we've been working with them, with the groups in Ohio. I mean, what do you think? Will the feds be able to bring it in? I mean, what's the latest you hear? Has that task force been done? Where are we?
I have heard absolutely nothing on whether the task force is actually when it will actually be formed, despite the fact that I'm somewhat involved in the process. So I feel like I would have heard it if it was, but no news on that. I mean, the thing is that will still have no force of law or anything along those lines. I maybe I'm too optimistic. I maintain optimism that in the next few years the federal government may come back, but the federal government has a thing where they tend to get a little bit tired of it. They get a little exhaustion from the issue. So I feel like there's probably a few-year delay or couple year delay before they come back. So yes, so states like Ohio so some states, right, like Connecticut, I think just has regulation on the ambulance companies themselves. So you can do sort of a way of doing protection for the entire state if you regulate the prices that the ambulances charge. So that's a few states have taken that sort of approach.
Okay, thank you, sir.
Other comments? Representative Ferguson.
Thank you, Mr. Chair. So with this QPA in limbo, what do you suspect will be the outcome of the dispute resolution? I mean, patients will still be kept out of the dispute, but
yeah. It's a lot more uncertain, right? So that's the idea, right? So if the part of this law was to also unwind some of this sort of the leverage and the higher premiums that had resulted from this market failure. And that was sort of the idea if the payments ended up near what sort of the median in network prices are, which basically don't account for sort of the outlier high prices of the few groups who are kind of really leaning into this issue, that you would see lower premiums and you might not if that doesn't happen. It's sort of interesting. I think the Trump administration was very much on the same page as the Biden administration on this front. But I still think the odds are that most cases tend to get decided based on the QPA. It is still the only concrete number that they are given in the law. They're still told to consider that. It is still the first factor that is listed for them to consider. My general experience, having studied state arbitration systems, is that arbitrators tend to just choose whatever the sort of concrete metric is, and by and large, right, there are obviously exceptions, but by and large, just stick with whatever that metric is. So, in New Hampshire, that metric is something like the QPA, and that seems to sort of hold the day. But in New York and New Jersey, something much more, sort of a much higher payment level is that sort of concrete metric. So, my sort of guess is that most things end up in a similar place, but with sort of more exceptions to that, and probably, so there's probably a higher average outcome. But really, one of the things is just it's a lot more uncertain, and I unfortunately can't give a super great prescription on. I mean, also, right, I don't know the final rule may have like another way to get at the same thing. It's possible they do the exact same, they could just, guarantee the exact same rule, and it's just, right, everything, the district court doesn't rule, you can appeal that as well. So I'm not a legal expert, so I don't want to pretend, but eventually SCOTUS would rule on that.
Representative Alversonson. Oh, I can't spit that out this morning, so go ahead.
Lauren, and so let's go back to I heard the magic word, which was QPA, and I wanted to probe that with you a little bit. So you're aware, no doubt, and make sure everyone in the room is aware that there was a bipartisan letter signed by 150 some odd members of Congress that felt like the agency's rulemaking and their over-reliance on QPA and arbitration was completely inconsistent with the legislative intent, which is something that, there's nothing that frustrates me more as a lawmaker than when an agency gets cute and decides, to listen to somebody other than the duly elected members of the legislature in terms of how they're going to actually implement law. So where do you think that idea came from in terms of the QPA? Because obviously you got a lot of members of Congress that feel like they're not being listened to, and that was not what was agreed to in the language. There are 7, if I remember, criteria that are supposed to be given equal weight in arbitration. That was the law that was passed.
Sure. So I think one of the things is, right, the whole debate around surprise billing at the federal level, every single bill was very centrally focused on this QPA. In Congress, you have this Congressional Budget Office who estimates the effects on the deficit and on premiums of various laws. Right, so every single bill, including the final one, they estimated would reduce premiums, and that is explicitly because they thought Congress meant for arbitration decisions to largely be close to the QPA. Right, if arbitration decisions aren't close to the QPA, you don't get those premium savings, you don't get those deficit savings, and right, that law was used to pay for other programs. So that was sort of the.
Did they just lie to the other members of Congress then? Because it seems to me like you got a lot of members of Congress that feel very strongly that was not the conversation that was had.
Yeah, I mean, it's interesting, right? So it's hard to know one congressional intent, because, right, so all the committees of jurisdiction all said this was our intent, right? So you had the Energy and Commerce and Help, who are the 2 actual committees of jurisdiction here, right? So they said this is our intent, right? But there's no one intent. When a bunch of people vote for the one bill, I don't know if there is one intent. That's sort of the idea here. I think the idea would be that this sort of rulemaking, the idea is that it ensures the law works the way it was intended, right? I think when the Trump administration was pushing this, it was very clear that they wanted this to reduce premiums as well as sort of stop the surprise billing themselves. But it's unclear. The courts are going to rule. I don't get to make that.
My guess is that, and this is why I think it's important, is because when you pass legislation based on a certain set of assumptions that people vote for, whether it's in the state house or the federal house, the completion of that legislative process is predicated on a deal that was made and a correct understanding. So obviously, if there was misinformation that was being circulated, and that was never the intent to begin with. It almost seems to me like we're back to benchmarking 2.0 here with the committees. I mean, the rules that have been promulgated, which, if that were the case, then why bother to put all of those other 6 criteria into the arbitration process to begin with? That's certainly not the direction we went in Texas, and our system is actually working quite well.
Yeah, so I mean, sorry.
So anyway.
No, I think that's, I think, right, I mean, I spoke before, I think odds are decisions end up near the QPA, or in Texas, my guess is they probably end up near the median and network price most of the time anyway, because that is sort of right, that's a concrete factor that folks are given, and it is sort of it is a reflective of some level of a market price. People can quibble over that, but right, it is some level of a market price.
So one more question for you, though, related to that. Why is not the previous contracted rate the more important number? If you're looking for a number, why not focus on prior contracting history?
Sure. So I think that's sort of where the large body of research on surprise billing comes in, right? That is, like, I think to me the body of evidence is quite clear that the previously contracted rates were buoyed upward by the sort of leverage that was brought about by this market failure. That without this market failure, and particularly for the sort of large, very high market power groups here, that those rates were higher than they otherwise would have been in a fair market. So that's really the idea, is that the prior contracted rates are almost always going to be higher than a fair market rate. And the median is the idea is you're kind of not, you're right, because by a median, by its nature, it's not right, so it is just the middle contract.
So you're saying that a provider group has more negotiating leverage than an insurance company that's on the Fortune 100? I mean, that doesn't make sense to me.
Well, so these are
certainly
large
not
private.
Been my experience.
I mean, so these are, right, in these specialties, this is KKR and Blackstone, and Welsh Anderson, Carson and Stowe. These are very large private equity companies, so it's not exactly, KKR and United aren't exactly that different.
But the driving force behind those things was market consolidation within the insurance sector and the inability of small groups to be able to effectively contract.
I mean, so the nice thing about this law, right, is it should help the small groups, right, because it's a median. So if you were getting paid, if you didn't have that market power before, you actually now get a benefit because of the law, right? And the median should be higher than if you weren't one of these private equity, big anesthesia or emergency doc practices. The law actually is a good chance it actually helps you.
Yeah. Okay.
Okay. Oh, Senator Hackett.
Excuse me, Tom, in Ohio, and I agree with Tom. In Ohio, we were successful in getting the bill passed, but one of the reasons we were successful was the emergency room physicians came in, and when it goes to arbitration, the previous contracts are brought into thing, because the emergency room physicians will tell you that they didn't really have any negotiating power, and then what would happen is they'd get something, they'd live with it, and then the next contract, they were just told it's going to a lower price. So that in the arbitration system, that is brought in, and I agree with you, Tom, 100%. I don't know where you got this thing that the leverage of because they can't really collude together because that's antitrust. They can't unionize. So I don't know. And so you see, that's what really put it over the top in Ohio, is the emergency room physicians came in and said, all right, but if you put this thing in the arbitration, they came in and lowered the price on the next contract. So I agree with Tom.
We'll have to agree to disagree on. I mean, right, Envision is 10% of all ER doctors in the country. It's not exactly, this isn't like a ramshackle organization here.
All righty. I don't see anybody else with a question or comment. I thank everybody for your input, and thank you, Mr. Adler, for your information here this morning. This topic, along with our next one, are just presentations for information. So at this point, we're going to move on to our next item, which is a presentation on status and future of Social Security system by Andrew Biggs, actually Dr. Andrew Biggs, Senior Fellow, American Enterprise Institute. Welcome.
Well, thank you very much. Good morning. I think I face a little bit of a bigger challenge than Lauren did, in the sense he's talking about something that's very cutting edge, just been passed, being implemented, being litigated. Social Security has not had any substantial changes to it since 1984. So for me to keep your interest is going to be a challenge. You could literally pick up a New York Times article on Social Security today, compare it to a similar article from, say, 1990, and they're going to read very, very similarly. You'll read about the retirement of the baby boomers, $10,000 per day. people are living longer, increasing lifespans, rising numbers of disabled workers. All of that means more beneficiaries pulling money out of the Social Security program. At the same time, declines in birth rates means fewer workers paying money into the system. The ratio of workers to beneficiaries, which, as I'll explain, is really the key factor of Social Security, that was about 5 workers per beneficiary in 1960. It's about 3 to 1 today. And by the mid-2030s, it'll be about 2 workers per beneficiary. I'm going to give you a little simple math that explains to you how those demographics drive the cost of the program. The average Social Security benefit today is equal to about 40% of the average wage of workers in the economy. And the Social Security benefit formula keeps that ratio pretty similar over time. So the benefit's equal to about 40% of the average wage, which means if you divide that 40% number by the ratio of workers per beneficiary, you'll find sort of the implicit tax rate needed to fund the system. So if we're back in 1960 and the average benefit's equal to 40% of the average wage, divide that by 5 workers per beneficiary, and you get a tax rate of around 8%, which is about what it was. Divide 40% by 3 workers per beneficiary, which we have today, you get a cost rate of around 13% of wages, which is where we are today. And divide 40% by 2 workers per beneficiary, what we'll have in the future, you get sort of an implicit cost rate of the program of about 20% of workers' wages, just for Social Security. Now, Social Security is already the biggest tax that most people pay. Most people pay more in Social Security payroll taxes than they do in income taxes. And so there's a lot of political resistance to raising that tax rate. President Biden has promised not to raise taxes on low and middle income workers, but congressional Democrats have almost unanimously co-sponsored a Social Security reform bill which relies on raising payroll taxes on low and middle income workers to make the math work. So this is a challenge for them. At the same time, Social Security is also the biggest source of income for most retirees. And so there's also political resistance to cutting benefits. And that's true even if we just cut them for rich people. It's even true if we cut them well in the future. I worked in the Bush White House in 2005 when President George W. Bush put a lot of political capital on the line to enact Social Security reform. Republicans controlled both the House and the Senate, and still we did not come close to passing that. So it's a very difficult thing. It's difficult to raise taxes, difficult to cut benefits, which helps explain why more than 30 years since we had the last reform, and more than 30 years since we knew we needed another reform, literally as nothing has happened. But then there's this third factor. Social Security is also the biggest line item in the federal budget. It's bigger than the military, bigger than Medicare, bigger than Medicaid. And if you don't do one of those above 2 things, cut benefits or raise taxes, then you've got a problem for the budget. Now, one way we think about this is what's called the Social Security Trust Fund. And from the 1980s through about 2009, Americans were paying more into Social Security than the system paid out in benefits. That surplus was, quote unquote, invested in special issue, non-tradable government bonds that are stored in a 3-ring binder in a filing cabinet in West Virginia. During the time I was in the Bush White House, the president pointed out that these bonds are just in this 3-ring binder, so they switched it to a locked filing cabinet. This is the general view of the Social Security Trust Fund. It's an accounting mechanism. It's like your credit card statement says, here's how much we borrowed from Social Security, but it's not a store of income that we can use to pay Social Security benefits in the future. So the trust fund surplus is the economic interaction is, in the years those happened, those allowed the government to either tax less or spend more than it otherwise could have. Of course, when we got to 2009 afterwards with the Great Recession, we just start repaying the trust fund. And what that means is we repay that using what are called general tax revenues. That's essentially income tax money. And to repay it, we either have to come up with that money, we either have to raise taxes, we have to cut other programs, or we have to borrow the money. And those are the same 3 choices you face if you didn't have a trust fund at all. So the trust fund commits the government to paying benefits. It's not like a fund, say, for a state government pension. You have actual, private stocks and bonds that you can cash in to pay it. The trust fund doesn't make it easier to pay those benefits. And under current projections from Social Security, the trust fund will run out around 2034, give or take a year based on how the economy works. Under a strict interpretation of the law, when the trust fund runs out of money, benefits would have to be cut by around 22%, because the way the law works, the Social Security legally cannot pay or cannot issue checks unless it has the money in the trust fund to pay them. So that's a 22% cut for not just new retirees, but for old retirees, for disabled survivors across the board, and it would continue essentially into the future. So that's something that a lot of people focus on. A lot of people in their personal lives will say, look, that trust fund's running out. I'm not going to get any Social Security. I'm not counting on anything. But there is kind of a hope or a saving grace. And this relies on the fact that the trust fund is essentially not real. And the way I look at this is say, if having a trust fund doesn't make it easier to pay Social Security benefits, not having a trust fund doesn't, in fact, make it harder. I'll explain it a little bit. By the early 2030s, the federal government is going to be repaying about $400 billion per year to the Social Security trust funds. And to do that, they'll use $400 billion of general tax revenues, which means essentially, again, income taxes. That's about 11% of all income tax revenues in those years is actually going to be diverted to go pay Social Security, to repay those trust fund bonds. Put it another way, about 20% of Social Security revenues are going to come from those transfers. Now, when the trust fund runs out, Social Security no longer has a legal right to demand that money. They don't have bonds in hand to say, you got to repay me. But that doesn't mean Congress can't or won't continue to make those general revenue transfers in order to keep benefits flowing. Congress could simply continue paying that $400 billion a year. On the other, if we do cut benefits by 22%, we're going to have an extra $400 billion per year sitting around the government doesn't know what to do with. They could give you a $400 billion tax cut, or they could continue paying Social Security benefits with it. They'll probably dress it up somehow. They might raise Social Security payroll taxes, but then reduce income taxes for the same people, so the Social Security continues to look the same and it looks like it's been reformed. But the reality is, if you're paying Social Security benefits in the year the trust fund runs out, likely you can continue or you will continue paying them in the future. Now, I'm not saying that is good policy. I've argued most of my professional life that we should reduce Social Security benefits going forward for middle and upper income people because they can afford to save more on their own. They will save more on their own. Back in the 1930s, that's not how our financial markets were set up. It's not how our economy worked. But today, it's a much, much different story. If you compare our private retirement system today in the 1970s, when traditional pensions were at their peak, we have more people participating in retirement plans. They're contributing a bigger share of their incomes to these plans. The total retirement plan assets in private sector plans are 7 times higher than they were in the 1970s. More people are getting benefits from these private plans in retirement. So we clearly have a system that can help substitute for Social Security benefits as we go forward. So I think the best policy is something similar to what you see in countries like Australia or the United Kingdom or New Zealand, where the government really focuses on providing a strong safety net against poverty and old age, while we put more of the burden for providing income replacement on people saving more on their own. Just as an example, Australia has one of the highest rated retirement systems in the world. Their government cost for their Social Security program is about half what the U.S. pays. And the reason it's half is that they enroll every worker in an employer-sponsored retirement plan, similar to a 401k, and the government simply picks up the slack with a means-tested anti-poverty benefit. So going into the future, their costs are projected to decline, our costs are projected to increase. We're paying more through the government. We're not necessarily getting better results. So I cannot, given Congress's inability to handle Social Security over the past 30 years, I can't promise that the best policy is going to happen. But what I think I can tell you is that you shouldn't fear that your benefits are suddenly going to be cut. I mean, I will turn 65 sometime in the mid-2030s. And I'll say I am not in great fear that that's going to happen to me. So we won't have the best policy, I think, but the likelihood of a retirement crisis triggered by Social Security's insolvency is pretty small. So thank you guys very much. I'd be happy to take any questions.
Well, thank you very much. And I think as you talked about good policy or best policy or whatever we want to call it, we know something's going to happen because in the game of being an elected official, there's no one that's going to go home and tell their constituents that we ended Social Security and expect to go back to office. So we're going to see some really creative ways coming forth here as we get into the early 2030s. And move forward. So with that, any other? Senator Burkhardt?
Thank you. Randy Burkhardt, State Senator from Minot, North Dakota. So I have 3 adult kids in their 40s, and I always assure them that there'll be Social Security, and I want you to give me a yes or no or that. But you're suggesting there might be reduced benefits if they're middle income or higher. Is that what I thought I heard?
It's possible. What I can tell you 2 things. First is the deal that has been promised under Social Security. You pay this payroll tax rate, 12%, and then you are going to get this benefit out from this benefit formula. That deal cannot be kept because the changing demographics make that unaffordable. Either the tax rate has to go up and or the benefits have to come down. At the same time, though, Social Security is a pay-as-you-go program. The money that you and I pay into the system today does not go to some account to be saved for us. It goes right out the door to pay benefits. What that means, though, is as long as we are paying taxes into the system, there's going to be money to pay benefits coming out of the system. It may not be the full promised benefit, but it is something. So the idea that we're going to get nothing from Social Security, that it'll be broke and we'll get zero from it, that's completely false. At the same time, though, the idea that we can get the same deal that we had before that's also false. It's going to be, Social Security has become a worse deal in the future. We're going to pay more and get less. It's just how the math works. But the program itself almost certainly will continue in the future.
So my follow-up question is, what was my follow-up question? Hang on just a second. Dang it. I might talk to you separately afterwards when I think of it.
Happy to.
Thank you.
Senator Klein.
Well, Mr. Chairman, and Andrew, many years ago when North Dakota's own Senator Ken Conrad was chairing the appropriations section, and I saw him on 60 Minutes, and the question was, what are we going to do? How are you going to fix Social Security? And he said, no one in Washington has the political will to address it. Have we gotten the political will? Are we we keep talking about it. The can is about as far down the road as we can kick it anymore. And now that I've reached those, I don't have to wait 12 years to be collecting. I'm there. I'm just kind of interested. We just keep talking about it, and we keep talking about it, and we've got some great ideas. Is there just any movement at all, any people at all talking about, hey, this is how we're going to fix it?
No, I think you're right. It is, if we were to sit down here and design a Social Security reform plan, we could do it in an hour. The math is not difficult. We all know what the options are. We can raise the payroll tax rate. We can raise the retirement age, cut COLAs. The whole, these are not exotic sort of policy reforms. It is all a matter of political will. We know that fixing Social Security earlier rather than later is the better way to do it. In general, the sooner you get on it, you spread the cost, you spread the pain over more generations of people. That makes the whole problem easier. The difficulty for an elected official is kicking the can down the road makes their lives easier. They say, I could take a difficult political choice today, maybe lose my job, or I could kick the can down the road, and whoever holds the same office 10 or 15 years from now, it's his difficult decision to make. So it really comes down to people just not wanting to tell Americans the bad news, that you're going to have to pay more and get less. And, I don't blame this all on, politicians, because the problem is that Americans themselves don't want to hear it. They want to kick the can down the road. They want to procrastinate. Everybody says, I care about my kids and my grandkids, but if you think about our entitlement program, Social Security, Medicare, you add the national debt, what we are cumulatively doing is putting more and more debt on our kids and our grandkids. So it comes down to just human nature, that people want to procrastinate, people are selfish, they don't want to take difficult decisions. That's why I think you need real leadership on it. President Clinton tried to do it, President Bush tried to do it, and neither of them succeeded. It cannot be done on a partisan basis. There is, right now Democrats control Washington, D.C. They all have this Social Security plan they want to pass. They will never pass it. The same as President Bush had his Social Security plan, he was not able to pass it. You really do need leadership to bring both sides together and say, we're going to tell America, some difficult truths. And if we do it together, we can survive. But if you do it on a partisan basis, it just won't work.
Senator Burkhart.
Thank you, Mr. Chairman, and I just thought of my question. So, there's no statute that guarantees that Social Security will always be in existence, is there?
No. The Social Security is, it's a law passed by Congress. They could pass a different law tomorrow and change your benefits. This is not like a private pension where you have some vested right or fiduciary duties and things like that. It's a tax levied by Congress on wages. It is a benefit paid to you by Congress based on your wages. There's no legal link between the taxes and the benefits. This was a constitutional thing going back to the Roosevelt administration, that they thought if there was a link, it would be unconstitutional. So you just have these two different things going on. They can change either of them whenever they want.
So this is a political dope slap for Congress, because they're kicking the can down the road for the next guy or the next person to address, which seems like a shame on you kind of deal. No offense to you, sir, but thank you for the information.
Sure. Hell, shame on them.
Thank you. Representative Thomas.
Thank you. You mentioned that the system for saving for retirement is much different now. So I'm just wondering if you have any stats on that. To the senator saying, my father told me Social Security won't be here, and I'm going to be eligible sooner than you are. And it's still here, and here for the foreseeable future. I've told my kids same thing. Don't depend on it. You're 20-some years old. Start saving now. So, from my perspective, young people have started saving by greater numbers at this point. If you have any stats on that, I'd be interested.
Sure. The private retirement side in America, you'll hear, this is not what you're going to hear when you open the newspaper or look on a website where they say, Americans don't save for retirement. If you go back to the 1970s, when traditional pensions were at their peak, less than 40% of private sector workers participated in one. And due to vesting requirements, most of those people who formally participated never actually collected a benefit. There's a study done by the Labor Committee in Congress in the 70s. They found like 9 out of 10 people who were in one of these traditional pensions never got a benefit. Today, around 60% of private sector workers are participating in a 401k. If you pay money in, you're almost certain to get money out. We're contributing more to those plans than we did in the past, because traditional pensions is only the employer paid in. Now we have the employer and the employee paying into retirement accounts. So we have more people saving more amounts than ever before. If you can look in Federal Reserve data on the total amount of assets held in private retirement plans, there is a clear kind of inflection point in the 1980s when 401ks started taking over from traditional pensions. Prior to that, you had sort of a slow and steady increase in assets. Then things really shifted up. So pension assets, even controlling for inflation and the growth of the economy, private plan assets today are 7 times higher than what they were in the 1970s. Retirement incomes, for all you hear, are at record highs across the income distribution. Poverty in old age is at record lows. Most retirees in surveys say, hey, we're doing okay. And yet, if you read the news media, they refuse to believe them. And so it's this is a system. It's messy. We don't have a single system. We have all these different IRAs, 401ks, pensions, 403bs. It's a mess, and yet it kind of works because we're giving a lot of people different options. And we need to fill in the gaps in that. But we have a system that is getting us in the right direction, and I think it's trying to fine-tune it rather than tear it apart.
Okay, I've got 3 more people on our list here. I've got Senator Lowe, Senator Felskowski, and Assemblywoman Carlton. And if we could just I want everybody to get a chance to ask their question, but we'll keep them as precise as we can and the answers the same way, because we do have another section to cover yet, and then followed up by the resolution that's on the table in front of everybody. So with that, Senator Lowe.
I was just listening to this and trying to understand what I thought I heard. And what I came up with, lower benefits or pay more taxes. And I don't know a legislator send this forward.
That's why they haven't.
So I thought I had stumbled on the right answer. I wanted to check.
We need to elect you to Congress, and you can do it in your single term in office.
Senator Felskowski,
Well, thank you. I just real quickly, and this is kind of for my own information.
you know, pull that mic up to you a little closer, then you'll
Sorry.
get recorded too.
So one quick thing is Social Security Act was passed, and then over the years we've kind of diluted it and given benefits out for more areas. Had we kept Social Security for retirement benefits, would we still be in the same position? Or can you even answer that?
If I had a spreadsheet, I could give you a better answer. Yes, beginning in 1950, we started paying out disability benefits. That's become a bigger and bigger part of the program.
Do you happen to know what percentage? I'm just curious.
Oh, I would say about 20 to 25% of benefits for the disabled. Now, you know, and that the growth of the disabled roles has been a matter of a lot of policy interest.
Correct.
Because I'll be frank, in my opinion, Americans' health is in fact improving. Jobs are less physically arduous. So you would think under those conditions the number of disabled will go down. But in the 1980s, Congress loosened up eligibility requirements, and I think that's kind of what drove it. If you did not have the increase in the disability rolls, the retirement part might be solvent, another 10, 20 years. I think eventually it would go
We'd
under.
be in the same position.
But that's something I could check on because it's a very, very interesting question.
Thank you.
Thank you. Assemblywoman Carlton.
Thank you, Mr. Chairman. So the one thing that hasn't been discussed is the maximum taxable earnings. So when I look at the chart from 15 up to now, it has increased incrementally. Where would we need to be with that earnings to be able to help us balance it out? Because if I'm looking at this, I mean, salaries now are much higher than when I believe people were looking at Social Security at the beginning. And the fact that it maxes out at 147, and we know that there are folks with a lot more income than that. I'm not saying go all the way to the last dollar, but I'm saying as we move forward, if I'm going to be paying that tax on my earnings, in no other way do I have a hard stop on anything. I pay it all the way through as far as like Medicare. So as the taxable earnings go up, where would we need to be to get closer to balancing this?
If you eliminated right now Social Security taxes are applied in the first $147,000 of your wages. Your benefits are calculated based on that same amount. If you eliminated that maximum taxable wage ceiling, that would, at one point, it would have made the system solvent for 75 years. Now it would probably cover about 3/4 of it. The reason you don't, though, is that, there's no, or very, very few countries around the world have an uncapped Social Security tax the way some people are proposing here. If you go to Canada, their version of the Social Security payroll tax stops at around $60,000, same in the UK. So people have talked about raising it. But the Social Security payroll tax is 12.4% of your earnings between you and your employer. If you were just to eliminate that, that's the same as raising your top income tax rate by 12 percentage points, which would be a big deal to do. It could be done, but it is not sometimes it's proposed as a simple fix. It would be a pretty dramatic change in the U.S. tax code to do that.
And I'm always wary when I ask a question that I'm not sure of the answer, but I want to make sure I really understand this because it's complicated. So we're taxed at 12%, but the maximum we go to would be the 147 that's listed for this year.
That's correct.
So basically, I'm talking about that 12% and the increments of it going up to, let's say, 200, 2.25. Is there a number there that gets us where we're going? I'm not talking about just totally eliminating it. I'm talking about different thresholds. How close do we get with those thresholds?
There is no number. I would have to check to say if we want to pick a given threshold, say $250,000, and say how much would that get you. I do know eliminating the cap entirely would not get you to full solvency. So something below that is obviously going to get you to less. The issue when we think about the political resistance is that if you have somebody who's making $150,000 per year and you're going to raise their marginal tax rate by 12%, this is not the private jet crowd. And so there's a lot of money there to be had because this is your vast upper middle class, but there are also people who don't see themselves as incredibly rich. And so, it can be done of just taking that $147,000 cap, raising it to $225,000, $250,000, something like that. But for people in that range, they are definitely going to feel it. And so again, it just gets why it's a difficult nut to crack. It would get you a bit, though. If I had to bet on what will happen, that's some increase in that cap is likely.
Okay. Thank you, Dr. Biggs, and thank you, everybody, for your comments and questions. Social Security is something we all have an interest in, so we're watching what's happening. So with that, let's move on to our next section. Section 4 in our schedule and our books here, Introduction and Discussion of Resolutions Supporting Independent Contractor Status for Insurance Agents and Other Licensed Financial Professions. Bringing that to us and starting us off, President Assemblyman Ken Cooley.
Thank you very much, Mr. Chair. Very proud to sponsor this resolution. This deals with an issue that has been brewing around the country, the status of gig workers as independent contractors or not. It arises out of looking at gig workers and trying to ascertain how do they access benefits in employment or not. Traditionally, there is a 3-factor test which is influential in determining whether or not you have someone who is an independent contractor or not. You also have a court decision, the Borello case, which has 11 related factors that you use to kind of classify an individual. In California, we had a court decision, the Dynamex decision, which was very stringent in the rules that applied, and the thrust of which was that many traditional independent contractors would be regarded as employees. We had legislation in California that tried to codify the Dynamex decision. So a very major bill back in 2019 that would have greatly expanded the role of employment and undermined in many professions the role of being an independent contractor. As that discussion proceeded in California, the bill, AB 5 of 2019, was eventually adopted, but it included a great many exemptions. And the very first exemption of which was that of an insurance agent. So insurance agents have a relationship with a carrier, but they organize their own business. It's even recognized independent. The insurance agency business is actually recognized in the California State Constitution of all things. But in California, with this debate brewing about gig workers and what's an independent contractor and how you should rewrite the rules, even in California, even in liberal California, we came down the side of exempting independent insurance agents from this change of law, so to ensure status quo ante with respect to insurance agents. And that is the thrust of the proposed resolution here. The aim is to have NCOIL speaking on behalf of the insurance business and independent insurance agents that any such rules should exempt insurance agents, other financial professionals from worker classifications tests such as the ABC test, so they can continue on being correctly categorized as independent contractors. A number of states have implemented this, including my own state of California. And I just think it's the sort of thing that NCOIL should speak to this issue and just say that is the right rule, that independent insurance agents are indeed independent. They shouldn't be classed as employees. And that is the thrust of this resolution.
Thank you. And just one quick note for the legislators here at the table. You've got your books, and that resolution starts on page 22. And so you can look over that as we go to Megan Gale, Policy Director of Government Relations, National Association of Insurance and Financial Advisors. Welcome.
Thank you, Chairman and members of the committee. Like you said, my name is Megan Gale. National Association of Insurance and Financial Advisors, you probably better know it as NAIFA. Thanks for the opportunity to speak in favor of this resolution, and we want to thank Assemblyman Cooley for his support and sponsorship. If you recall, this committee heard several presentations, including from myself on worker classification and the federal legislation around the PRO Act in the summer of Boston. Since then, there has continued to be, the independent contractor model has continued to kind of come under attack from, not attack, but is come up for debate on both federal and state levels. And our industry, while is not the primary target of these efforts, is more of a bystander of the attention focused on the gig economy, which almost, of course, exclusively uses independent contractors. This is particularly relevant around the ABC test because we do feel often that insurance producers, since their primary course of business is to sell insurance for insurance carriers, would trigger this ABC test and be considered employees. The insurance business model reflects the reality, the independent insurance business model reflects the reality that producers are primarily engaged in sales activities. They often sell products from multiple different insurance companies and are not subject to the traditional employer-employee control characteristics. And so NAIFA conducted a survey last year of over 1,000 of our members across the country, and 90% reported 1099 income indicative of independent contractor status on some level, and 95% of those who currently operate as an independent contractor wished to do so. There's just no appetite amongst the industry to be caught in to this larger debate and be classified as employees. As many of you know, a career in insurance and financial services is maybe not what a lot of people graduate from college expecting, except maybe perhaps Assemblyman Cooley. I know that it wasn't for me. When I started as an insurance agent, was a second career, and this is the same for many. They're drawn to become an agent for the entrepreneurial nature, the opportunity to build their own small business, and being forcefully reclassified as an employee significantly undermines this. So we've worked with several states, including California, Alabama, on these issues and feel that the exemptions are appropriate. So we ask for your support in recognizing that insurance and financial service professionals have a long history of appropriate classification as independent contractors and are not involved in the worker classification problems found in other industries. And we should remain under that status if they so choose. So thank you, and I'm happy to answer any questions.
Thank you. Do we have any questions? Ms. Carlton? I don't see any. Back? Well, not seeing the Assemblyman Cooley. Do you have further comments? And I think at this point, too, if there isn't questions and concerns, you could move.
I'm sorry.
Oh.
First of all,
yes,
agree with this. I would actually make a motion to adopt this resolution.
Okay.
Second.
We have a motion and a second to adopt this resolution. Any further comments? Seeing none, all those in favor signify by saying aye. Aye.
Aye.
Opposed? Motion passes. Thank you. And with that, then we will jump to any other business, and with that, we're going to go back to Assemblyman Cooley to talk about the resolution that is at everybody's at the table here. And we heard conversations this morning at breakfast from Assemblyman Cahill and Assemblyman Cooley there also about what is going on in Ukraine. So, Assemblyman Cooley.
Right. Thank you very much. Yes, that resolution is before this committee, and the operative purpose of this resolution is actually put our organization on record urging, this is the operative language, NCOIL urges members of Congress to condemn the Russian attack on Ukraine stand with the United States and its allies, President Joseph Biden, the people of Ukraine, and Ukrainian President Volodymyr Zelensky in opposition to this war, and that copies of this resolution then go to House Financial Services members of the Senate Banking Committee, Speaker, Majority Leader, and NAIC, and the chair of all state committees that have jurisdiction over financial insurance matters. So obviously this resolution relates to the contemporary circumstances, and on February 24th, Russia invaded its neighbor Ukraine, threatened their democratically elected government in an attack violating the rule of law, national sovereignty, free democracy, and as a freely elected democracy, Ukraine and its president share many of the same democratic principles that we adhere to in our respective states. And they are fighting to defend and preserve, of course, these ideals. But as I shared, the first line of their national anthem is, "Dignity and freedom of Ukraine has not yet perished." So they are actually trying to preserve their national dignity, their freedom, in the face of this onslaught. And I do think that, coming out of World War II, there's that famous quote that they came for the trade unionists. I didn't speak up, I wasn't a trade unionist. They came for this person, I didn't speak up because I wasn't this. They came for the Jew, and I didn't speak up because I wasn't Jewish. And they came for me, and no one was left to speak up. It's just a moment where very dramatic things are afoot. All of our work, our lives are invested in democracy, democratic principles, and a way of going about resolving differences short of the gun. And so I just bring this forward. It passed, I will say, yesterday unanimously, bipartisan, colleagues on both sides of the aisle, very eloquent on behalf of this. And I just am honored to bring it to this group as appropriate for our body.
Thank you very much. It's a very well-written resolution as you go through it, through each section. So with that, I would be looking for a motion on this resolution. We have a motion and a second.
Yes, very good.
Any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion passes. Thank you very much. Okay, with that, we have reached the end of our committee business. And before I let you go, we're not going to let you go very long because what do we have? About 5-6 minutes after 11. And 11:15, we're going to start with the Workers' Compensation Insurance Committee right here. So you got a few minutes to stand up and stretch your legs, and we'll see you back here real quick. We are adjourned.
Mr. Chairman, if I may, in NCOIL evaluations, the most frequent knock we get are meetings going over long, which makes the day go over long. So it's not lost on us that in the chairman's first meeting as chairman here, he's finished 9 minutes ahead, and that should be a hallmark to other chairmen, so we thank you.
Yeah, yeah, that's good. Okay.